Welcome to this video, friends. My name is Dr. Saeed Kazmi, and today I'm going to talk about clinical approach to jaundice. And here I would be focusing on jaundice in older children. I would not be focusing on the clinical approach to jaundice in the newborns or in neonates, because I have a separate lecture for that, and that's altogether a different domain. So in this particular lecture, the focus would be entirely on older children. But for those of you who are watching my channel for the first time, please do subscribe to my channel and also press the bell notification icon, so whenever I upload a new video, you're always on board with me. And if you like my videos, then share it with your friends, and if you don't like it, then obviously share it with those whom you don't like. Anyhow, without further ado, let's dive into our today's topic straight away. So I would be focusing on clinical approach to jaundice. And you know that jaundice is actually yellowish discoloration of the skin and mucous membranes. Now, whenever you come across a child who has got this complaint of being yellow, either in the skin or in the mucous membranes, the very first thing as a doctor or as a pediatrician you should do is to confirm whether it is jaundice. There are certain mimics of jaundice which are like beta-carotenemia. That's a separate condition in which the child can look jaundice. Sometimes hypothyroid children, those who have got mixed edema, they might have a yellowish tinge to their skin, and that might also be mistaken for jaundice. Then there are a few other conditions in which there might be a little bit yellowish tinge to the skin. So you have to exclude that. And how do you exclude that? I mean, very simple, that even a CAP-CAS can show you the total bilirubin levels, and if it is more than the normal for that age, then obviously you would consider it to be jaundice. So before we talk about all those fancy tests that are used to further work up jaundice, like doing direct, indirect, and then liver ultrasound, and then the, let's say, hepatitis screens and all those things, please keep in mind that you can cut down on some of these unnecessary tests if you take a proper clinical approach. And that would be the crux of the talk today. So once you have excluded that it is not beta-carotenemia or there's not other mimic of jaundice, and obviously the child is jaundice, then the next approach is to ask the mum of, or whosoever is the guardian of the child, that what is the color of the urine and stool. So this is very important, because that would further guide you to dissect your differential diagnosis. So if a child has got normal urine color with it, so it is not like dark orange colored, and the stools are not pale. So if the urine and stool color is normal, then remember the next step would be to look whether the child is pale or not. That would be the next step, because if the stool and urine is normal and if the child is pale, then it probably means that the child has got hemolytic jaundice. So there is some hemolytic process going on that is causing jaundice. And then further on your examination, if that child has got hepatosplenomegaly, then you can think of some of the causes of chronic hemolysis, like thalassemia, sickle cell, and so on and so forth. So remember, if there is pallor with normal stools and normal urine color, remember that is hemolytic jaundice. So again, then you can dissect whether it's an acute hemolysis or whether it's chronic hemolysis. And again, your physical examination, obviously if a child has got hepatosplenomegaly, that simply means that the hemolytic process has been going on for a long period of time, and then you can think of all, you can narrow down your differentials based on this approach. If the child has got no pallor and his stool colors is normal, his urine is not dark, then that child probably has got enzyme deficiencies. Some of the enzyme deficiencies which can cause indirect jaundice, and these are the kids who do not have got like discoloration of the urine or discoloration of the stools or pale stools, like Crigler-Najjar syndrome, that can cause this type of condition. So it's a very simple word. If the urine and stool is not discolored, look for pallor. If the pallor is there, then it's most probably hemolytic jaundice, you can further work up for hemolytic jaundice, look at the retic count, do the examination, and your test would be based on that. Again, you can look for all those causes which can cause chronic hemolysis or even acute hemolysis like G6PD deficiency, blah blah blah. Okay, if the child is not pale, then most probably think that this is some form of enzyme deficiency, and then you can do your workup for those enzymatic conditions which can give you this type of condition. Now, the second thing, if the child is jaundiced and the guardian, the parents, they say that the urine is dark in color, the stools are pale in color, then look at the condition of the child. If the child seems unwell, if the child has got fever, if the child has got this acute condition, then you can think of acute hepatitis. And again, acute hepatitis does not mean that we are talking about acute viral hepatitis. Obviously, in tropical countries, you will be thinking more of acute viral hepatitis, like acute hepatitis A, acute hepatitis E. Sometimes even the hepatitis B in acute form can give you some form of the similar picture. So not only acute viral hepatitis, sometimes acute immune-based hepatitis can also cause the same condition, or toxic hepatitis, which is caused by different types of chemicals, like for example in paracetamol poisoning in the later stages, as the liver failure sets in, the child can be jaundiced. Similarly, if somebody has consumed a lot of toxic mushrooms, that can give rise to fulminant hepatitis, and that would lead to that condition. Or sometimes Rice syndrome. Rice syndrome is thought to be caused by aspirin, but we have seen that it's not exclusive to aspirin. Sometimes a viral condition can simply trigger Rice syndrome. So there will be acute hepatitis and encephalitis, and that's a very grave condition with a very high mortality rate. So keep those conditions in mind. So if a child is very unwell with jaundice and he has got dark urine and his stool colors are pale, then obviously think of acute fulminant hepatitis, and I told you the history would give you a clue. If the child has got jaundice while he's not very unwell, then think of obstructive jaundice, and this is what we call as post-hepatic jaundice, like either there is some obstruction to the outflow of bile from the liver. So it could be a gallstone, it could be a stricture in the common bile duct, it could be a choledochal cyst, or it could be simply like some form of acquired obstruction to the outflow of the bile duct. So these are some of the conditions. Again, you can work up for that, an ultrasound or HEDA scans, and again even ERCP and MRCP in older children can also narrow down the differentials, can not only be diagnostic but can be therapeutic in certain forms of obstructive jaundice. Now, if the child who is jaundiced has got discolored urine or pale stools, but otherwise looks very well, I mean he's running around, he's thriving well with that, again then think of enzyme deficiency. Some of the enzymes like Gilbert syndrome, Dubin-Johnson syndrome, they can have often on jaundice, but otherwise they are very well, and they are thriving, there is no fever, and they seem to be well, apart from that they are just jaundiced. So this is the clinical approach to jaundice. I mean, it's simply you look for jaundice and you ask a few questions, you do a basic physical examination, and you can narrow down your differentials. So you don't have to do all those tests, you don't have to do battery of all the, let's say, the viral panels, ultrasounds and all that, unnecessary tests. So you have narrowed down your differentials, you can just order those tests which are necessary, and that would further lead you to the diagnosis. So that, in very simple words, is the clinical approach to jaundice in older children. I hope you have understood, and this would help you in your clinical practice. This would also help you in your exams as well if you've got questions on jaundice. And if you have liked my video, please press the like button, share it with your friends. And if you've got any questions related to this thing, you can put your question down in the comment section below, and I will get back to you as soon as possible. Have a good day, stay safe and stay healthy. Bye bye.